Glaucoma secondary to epithelial ingrowth. Epithelial ingrowth or downgrowth. It is a rare but potentially blinding complication of anterior segment surgery or trauma, occurring when conjunctival or corneal epithelial cells migrate through a wound and proliferate in the anterior segment. So here is the proliferation and stratified squamous epithelium lining the anterior iris surface and filtration angle. Elevation of IOP is due to trabecular obstruction by one or more of an epithelial membrane, secondary synechial angle closure, and desquamated epithelial and inflammatory cells. The associated glaucoma can be particularly intractable, and the prognosis is poor. Diagnosis: there is persistent postoperative anterior uveitis, diffuse epithelialization characterized by gray translucent membrane with a scallop border that involves the posterior corneal surface in the area of a surgical or traumatic wound. So here you can see the translucent membrane with a scallop border involving the posterior corneal surface. This is the posterior corneal surface, and cystic and fibrous proliferative patterns sometimes occur and tend to have a better prognosis. Cystic and fibrous proliferative patterns. There is pupillary distortion. Treatment. The aim of treatment is the eradication of all invading epithelium to avoid recurrence. Block excision involves the simultaneous excision of adjacent iris and pars pliccata of the ciliary body, together with all layers of the sclera and cornea in contact with the lesion. The resultant defect is covered with tectonic corneoscleral graft. The area of iris involvement may be delineated by applying argon laser burns, which will cause widening of the affected area. Cryotherapy may be applied to devitalize the epithelium and remaining on the posterior surface of the cornea, in the angle and in the ciliary body. Trabecular air is used to insulate other tissues from the effects of cryotherapy. Intracameral 5-fluorouracil has been tried with variable results. There is some evidence that intravitreal injection of methotrexate 400 mg divided by 0.1 ml every 2 weeks for 6 cycles. So injection of methotrexate can lead to successful resolution of the ingrowth. And 5-fluorouracil. Glaucoma drainage devices are of value for medically uncontrolled glaucoma associated with extensive epithelial ingrowth, unsuitable for surgical excisions.